Stanford University.
Welcome to Stanford Medicine's 10th Annual Contemplation by Design Summit. I'm Dr. Tia Rich, the founder and director of Contemplation by Design, and it's my deep honor to introduce our two speakers for this evening's session, Dr. David Spiegel and Dr. Manuela Kogon. They will be speaking to us about the role of interoceptive and exteroceptive stimulation in the enhancement of health, contemplating the body as a means of modulating brain circuits. Manuela Kogon is an integrative medicine internist in private practice and a clinical professor at Stanford School of Medicine. She serves as the medical director of integrative Psycho-Oncology at the Stanford Center for Integrative Medicine. Her expertise in internal medicine, psychiatry, and integrative medicine serves to advance the clinical application and study of body-mind medicine. She is the author of When Cancer Visits, How to Free Your Mind from the Grip of Distress and Heal Your Jolted Nervous System. David Spiegel is the Wilson Professor and Associate Chair of Psychiatry and Behavioral Sciences and Director of the Center on Stress and Health and the Center for Integrative Medicine at Stanford University School of Medicine. He has published 13 books, 425 scientific journal articles, and 175 book chapters on hypnosis, psychosocial oncology, stress, physiology, trauma, and psychotherapy for stress, anxiety, and depression. His research has been supported by the National Institute of Mental Health, the National Cancer Institute, the National Institute on Aging, the National Center for Complementary and Integrative Health, and a number of foundations. He is past president of the American College of Psychiatrists and the Society for Clinical and Experimental Hypnosis, and is a member of the National Academy of Medicine. Join me now in warmly welcoming Dr. Spiegel and Dr. Kogon.
Welcome, everybody. You know, a fancy title, role of interoceptive and exteroceptive stimulation. So we're going to talk what exactly that is. So exteroceptive stimulation is something you all know. Exteroception is basically all the stimulation that comes in from the outside that you perceive with your senses. You know, visual. You can take a moment right now, look around. I assume most of the audience is in California and it's already dark where you're at. So we talked about visual. So take a look around. What is it that you see right now? And I also want to alert you that it's not just the stimulation that comes in from the outside. You know, it goes through your eyes and it registers in the brain. And notice if you notice a difference of what you experience depending on what you look at. You know, right now we're looking at lovely photos, and if you look at a photo of a loved one, you might have a pleasant emotion while you're looking at that photo. But if you look at other things, you might have a different emotion. So just notice what goes in has an impact. So visual, everybody is familiar with that. Same with sound. You know, maybe you have music in the background right now. Listen to what you hear right now. Train going by, someone talking. And is it pleasant or an unpleasant experience? Most of us don't notice how much goes visually and from your auditory system into the brain and activates you. So just pay attention to what is happening right now. Same with tactile. You know, you can touch your skin right now and see how that feels. Is that mild tickling sensation pleasant? If someone actually tickles you, it might not be so pleasant. Just pay attention to that experience. Same with smell. What are you smelling right now? And have you experienced these things? Exteroception, the sense and interpretation of our external environment. So it's happening right now. with your eyes, with your ears, with your nose, what you feel, and gustation, the ability to taste. People argue if that's part of interoception, which I'm going to talk about in a minute. But the taste, you can argue it's inside of your body, so it's interoception. But when you stick out your tongue, and yesterday was Halloween, there were a lot of gustatory experiences where you put a candy in your mouth and it was sweet or it was sour. So all these senses that you're constantly experiencing, all going inside, and we'll be talking how they impact the brain and what you can do about if you don't like the impact. You can use the impact to facilitate health, well-being, but you can also use it to, create pleasant experiences. Which gets us to the next, which is interoception. This is now something that most people have never heard of, which is the sense, or if they have heard of it, not really using it in their lives. So not just the sense from what comes from the inside, but also the interpretation of our inner environment. The things that people most easily can relate to when they hear this notion is the lung, breathing. So if you take a breath right now, when you inhale, just notice how you do that. Some people tend to pull up their shoulders when they breathe. See if you can actually just sit there, imagine the lung as a balloon, and you inflate it more to the side and downward. The body doesn't move, the lung moves. That's called interoception, the experience of the signaling from your lung to the brain. What it does in the brain, we'll talk about in a minute, but first I want you to just experience that physical sense. Same with the heart. Can you actually feel your heart? Some people do, some people don't. And you can actually play with that. If you now take a deep breath and hold your breath, see if your perception of your heart changes. For people that have a diagnosis of anxiety, they got to be thoughtful with that exercise, because that stimulation of the heart that makes you feel it can be unpleasant. So what I'm instructing you to do right now is not automatically making you feel better, it's just making you aware that there's organs inside of you that signal us. So heart and the lung, we'll talk more particularly about the lung and breathing in a little bit as a way to influence our inner systems. But think of the bladder. That's an interoceptive organ. Some of you probably have to go to the bathroom right now. You have to pee. And you have some control over that mechanism and that signal, but only to a certain degree. At one point, you gotta go. So an entry point into having some control over those systems. Same with the gut. Think of hunger. That's an interoceptive signal. Are you hungry right now? And what do you do with that signal? It originates in your stomach, and then it travels up to the brain. And in some people it says, oh, let me eat a carrot. But in other people it says, let me eat 10 cookies. So the experience from the body itself travels up, but then it gets interpreted and we're acting upon, which is what the next slide is about. Strictly speaking, people sometimes argue that interoception is really just what happens in the body. While interoceptive awareness has been more narrowly defined as the representation of afferent body sensations. So I just gave you a long description of body sensations, and afferent just means it travels up to the brain. Efferent is from the brain down. So strictly speaking, narrow definition, just what happens in the body. But when you keep reading, broader definition casts interoception as a multidimensional construct that also takes into account how people attend, appraise, and respond to these sensations. This is now very, very, very important. It's in some ways the most important information, and it's not just what happens inside. It travels up here, and you have a fairly complicated, or not fairly, super complicated machine up here. And it pays attention, and then it appraises, and then it responds. You know, I gave the example of the heartbeat. So some people can't feel their heartbeat, but if you hold your breath, you probably will feel your heartbeat because it will go up. Not everybody, but whoever does that. But some people then appraise that as danger. Oh my goodness, my heart is beating fast, and it's something dangerous, even when it not necessarily is dangerous. So just pay attention. Stuff comes from the inside. You pay attention to it. Then you appraise it, but sometimes you misinterpret that signal. And your response is appropriate when you appropriately interpret it, but sometimes the response is inappropriate when you misinterpret that signal. And we'll give you examples for that. So here is a fancy slide that I really like. I stole it from David from one of his talks. And I took the liberty to even hijack it a little bit, because where you had mind-body control, I changed it to modulation. So it's really nice that what comes in from the outside, remember, we're talking about outside stimulation, we're talking about inside stimulation. And then this poor machine up here has to do an appraisal and an interpretation, and then act on it. And these brain areas that we don't have to go into detail help with that coordination. And sometimes, unfortunately, they don't do a perfect job, which I want to show in the next picture, which is the fancy version that David had created, which is you paying attention to exteroception feed. Stuff comes in from the outside, stuff comes in from the inside. And this poor little machine up here has all kind of biases. It might be based on a biological difference. We'll talk about that in a minute. It might be based on conditioned thinking. You will experience a certain stimulus very differently depending on how you were raised, the societal, influences you have, and unfortunately also fear. Fear signals whatever happens outside. When it arrives as fear in the body, it very much distorts our thinking. And we'll talk also how you can alter that response.
I might add something. I'm reflecting as you're talking, Manuela, that it is odd indeed that we have to sort of call attention to interoception. And I think in part it's because in evolution, we were fragile and vulnerable creatures. And so we had to pay a lot more attention to our external environment to monitor for danger. And we sort of take our internal environment for granted, usually unless it's a negative experience. Mm-hmm. where you're sure to have interoception is when you're in pain, for example, then you're noticing that. But otherwise, we seem to be built to be excessively attentive to the external environment and inadequately attentive to the internal environment. I think that's one reason that mindfulness is such a popular thing now, that it gets you to turn inward and pay attention to the flow of feelings and thoughts that go through you. So it's ironic that we have to say, pay attention to what's going on inside, but we do.
Yeah, and I like that comment. Maybe we can use it to just slow down and notice again what you experience on the inside. You know, I gave you choices of bladder, gut, stomach, heart, and lung. You know, you can't feel your liver. You can't feel your kidney. You know, the kidney doesn't say I have to go to the bathroom. It's the bladder that tells you by expansion. And is there an experience right now that you experience as particularly pleasant? Pay attention to your breath for a moment. How are you breathing? So when you breathe in, you know, I mentioned shoulders pulling up, but are you breathing in casually? Can you really expand the lung? And if you feel like the lung is filled up, see if you can take an extra little whiff, kind of what's called a cyclic sigh. When you breathe in a little more until filled up. It's a double inhale, and then just let the sound out, the breath out, either with a sound or without a sound. Like breathe in, fill up the rest, and then breathe out. And just observe if you feel anything. What are you thinking when you do that? Is there a commentary running in your head? It's pleasant or it's weird. Is there an emotion attached? How does your body respond? And it's not a coincidence that I'm showing you that particular breath, because we have studied it, and we'll show you in a minute how you can use it to alter that system. So far, we've mostly talked about stuff comes in from the outside, from the inside. And as you see on this picture, interoception, exteroception, it's complicated. You know, if you're activated, which is called hyperaroused, that system doesn't quite work. You know, it pays attention to what's happening, either from the inside or the outside, but it can't quite respond under stress. Many of you have probably noticed when you are stressed, sometimes the thinking freezes and you don't know what to do, or your heart starts beating and you can't function properly. You can't retrieve information. And again, the details on the picture on the slide itself themselves are not the crucial part, but the importance that what goes in here needs to be processed appropriately, healthfully, and you have some influence over that. That's really something we both want to emphasize. You're not just at the mercy of this machinery.
I might, before you go on, just add a few comments about the balance and imbalance in the system, because part of the idea here is we're emphasizing three neural networks. One is the central executive network, primarily the dorsolateral prefrontal cortex. It's the part that hopefully is operating in me and in Dr. Kogon at the moment, where you're describing, thinking through, planning, explaining. That's how that works. The default mode network is in the posterior part of the brain primarily, although also in the ventromedial cortex. And it's a part of the brain that when you're not operating the central executive network too much, you tend to reflect on who you are and what people think about you. And it provides a kind of evaluation of what the executive network is doing, what people think about you, how you think about yourself. The salience network is an alarm system that basically says if there's a loud noise, you better stop doing these other things and pay attention to what's going on. So normally we function with a relative balance among the operations of these three networks, except some mutually inhibitory activity between the executive control network and the default mode. However, in a hyperaroused system, the default mode network is usually in a state of worry, and the salience network is firing off and saying, there's danger, look out, and you're hyper alert, but you don't usually think that clearly at that time. You're inhibiting your executive control network. And you see that in people with post-traumatic stress disorders, certain kinds of PTSD, where there's hyperarousal, irritability, inability to concentrate. There's a third type of relationship among these systems, dissociation, which happens to people often in severe trauma, where the salience network has been shut down. The central executive network is saying, I'm taking over and we're going to disconnect you from what you're experiencing. And so many people in times of physical stress or trauma find themselves almost detached from their bodies, feeling like, I'm sorry for what's happening to the body beneath us. And sometimes that's an adaptive ability. But what we want to show you, and this will relate to the things that we recommend for helping people cope with these things, is that different patterns of relationship among these three systems have profound effects on our general level of emotional arousal, on our ability to concentrate, plan, and defend ourselves if we need to. So that's the framework that we want to present now to help put into context the things we'll be talking about next.
Dr. Spiegel, that was very illuminating. If we could just round out the details, you named the regions of the brain that constitute the central executive network and also the default mode network. Perhaps I missed it, but I didn't hear names of regions for the salience network.
Thank you. My executive control network wasn't working perfectly. So this is the dorsal part of the anterior cingulate cortex. Thank you, Tia. The anterior cingulate cortex is something that looks like a C on its ends, right smack in the middle of the brain. And the dorsal region in particular is involved in arousal, emotional arousal. It's a pattern matching system. And when suddenly there's an aberrant pattern, when something happens that maybe shouldn't be happening, it will kind of hijack your attention and get you to focus on that. The default mode is in the back. The posterior cingulate cortex is a big part of it. And the other part of the salience network that Dr. Kogon mentioned before is the insula. So we have a kind of alarm system at the base and center front of our brain that involves mind-body connection, brain to body, but also body to brain through the anterior and posterior parts of the insula, and the dorsal anterior cingulate cortex, which is our alarm system.
Thank you.
So you can translate that, what David just said, maybe in a situation you have experienced in life. It could happen that a lion now walks through the living room, and then we will have to respond to that. And our brains either freeze and we won't walk away and run away, or we will have what's called tonic immobility, where you just literally can't respond to a stressor like that. But you can take something milder. We talked earlier about auditory stimulation. Imagine someone tells you, "You're such an idiot, I hate you." That is going through the salience network, and then will be tended to as, well, do I have to take this seriously? Do I have to respond to it? It doesn't always have to be a life-threatening exteroceptive or interoceptive stimulus. The default network has a tendency, particularly when it's stressed, to misinterpret the meaning of the stimulation. If I now call you an idiot, you won't respond because you're not an idiot. but
I am shocked nonetheless.
Yeah.
But I think the point that Dr. Kogon's making is that when the input is stronger, it becomes more of a challenge for the brain to respond at the right level of response, to not overmodulate, freeze, and not respond when you should, to protect yourself or defend yourself. On the other hand, not to overreact. We see that among nations fairly commonly, but we're also seeing it, you see it in humans all the time, that normally it's pretty easy to have the right degree of modulation and response, but when the stimulus is very strong, it's more of a challenge for the brain to respond at an appropriate level to the stimulus.
And some of these things also happen unconsciously. So what we talked about is when we perceive, the stimulus, if you have a heart attack from the inside, or if the lion does walk through your living room, but sometimes, someone might say something and your brain interprets, and you don't even realize that you're aroused in response to it. You might be angry, and it has this subliminal, experience in you. So pay attention, realize that this happens constantly, hundreds, thousands of times a day. Sometimes we can modulate and sometimes we can't. So be aware of how much goes in there in this poor machine that all has to separate it all and make sense of it. So maybe a pause just for everybody to settle into all this information. It's a lot of information to process, and always resort to the simplicity of the type of information that comes from the outside: vision, ears, smell, taste, touch, and the information that comes from the inside: heart, lung, gut. See what you feel again. What did you experience in response to this information? Could you process it right away? Do you want to slow it down? Do you need to slow it down? Just see what you experience right now. You're being stimulated right now. We're bombarding you with a lot of information to process, and it all pertains to you, to your brain, and to your experience. So, and as Tia said, we're holding questions to the end, but if you notice anything in you, jot it down that you want us to draw attention to later. So then we would go on to also pointing out not all brains are the same. So how we perceive these things have huge individual differences, and there's just one study David did that you're going to talk about one of those differences.
So, we are all our own internal pharmacies. And we know, for example, there are endogenous opiates in the spinal cord and in the brain. There are also endogenous anti-anxiety regions of the brain. In one study we did of people who are have differences in hypnotizability, which is a very stable trait. Hypnosis is just a state of highly focused attention that occurs naturally when you get so caught up in a good movie that you forget you're watching the movie and enter the imagined world. That's a kind of spontaneous self-hypnosis. All hypnosis is really self-hypnosis, but one of the stable differences is hypnotizability. One of the ironies in human development is that the peak period for hypnotizability in the life cycle is the latency years in childhood. So that means that all 8-year-olds are in trances all the time. As you know, if you call in your kid for dinner and they're playing, they're not interested. We tend to lose some of our hypnotizability in adolescence as we learn formal operations and we learn to value logic and thinking over experience. But by the time you're 21 or so, your hypnotizability is pretty much set for the rest of your life. And over a 25-year interval, there was a study done at Stanford that showed that IQ was as stable as, that hypnotizability was as stable as IQ. It's about a 0.6 test-retest correlation and a blind retest of hypnotizability. And so we did functional magnetic resonance spectroscopy, looking at the presence of certain neurotransmitters in the brain. And we found a positive correlation in the anterior cingulate, this alarm region in the brain, between hypnotizability and the presence of GABA, gamma-aminobutyric acid, which is a major inhibitory neurotransmitter. It's basically the mechanism by which most of the anti-anxiety drugs work, alprazolam and diazepam and other anti-anxiety medications. And so what it shows is that people who are more hypnotizable, who are very good at getting absorbed and changing their mental state, can do so in part because they literally have more inhibitory neurotransmitters in the alarm system in the brain. And we'll talk some more about that later, but it suggests that our brains are built to help us manage stress, and some people have more of that ability than others, and this is one reason why.
And again, that's also something you can pay attention in yourself right now. How absorbed are you in the activity you're engaging right now, which is listening to us, seeing us? Do you notice that your mind wanders, or are you zeroed in on what's happening? And if you do wander, notice what you're wandering to. There are thoughts that are associated with it. Again, feelings, it's stimulation, and you're processing it. How present are you for it? And if you do wonder, is it hard to bring back your attention? What is it that might make you go away from paying attention? Not necessarily a bad thing. Just notice what you're doing in reference to the information you're hearing. So now, we already talked about the brain in terms of, information coming in from the outside. We're now talking first about exteroception. I give you a couple of examples just to realize the magnitude. Again, you're seeing something and you're not paying attention to the fact that it actually has to register in the brain. This is a study David will talk about more in detail. But just to illustrate, imagine you're seeing something, a light source, it lights up, and the back of your brain registers it. Again, on the left side, you see these lines as an illustration of what's called an evoked potential, where the brain lights up and says, oh, I saw the light source. But if you now ask people to imagine that there's a wall between the light source and them, that evoked potential, that activation in the brain goes down. So the light source is always the same, but with your ability to imagine that there's something between the light source and your brain, the response in the brain goes down. And when you look at when this was done, 1985, we had no way of looking inside the brain with a functional MRI at the time. So it's a very neat design to look into the brain of what happens, not just when the light source hits the brain. Of course, there's an evoked potential, the brain lights up, but you can modulate the response. And David will talk in more detail, also, walk you through an exercise where you can practice that tonight. And here is one that you're going to talk about with respect to color processing.
So the point that Dr. Kogon is making, and is very important, is that the brain is not simply a repository of external sensory input, and that in fact, interoception can affect exteroception in a very powerful way. So the way in which we perceive the world around us is not simply the pure product of input, but it is rather the interaction between the input and the way your brain is prepared to process whatever the input is. And that can be a problem. You can distort what you see and not hear things you should, or not see things you should. But it also is a tremendous, powerful therapeutic opportunity, an opportunity to moderate things like pain, and we'll talk about that a little later, by setting up a competition rather than cooperation between interoception and exteroception. So this is an example in which I was challenged to come up with an experiment that would explain the previous one that you saw. Well, maybe the brain just shuts down, was one psychologist's explanation. It's just not paying attention, and so it just shuts everything down, nothing specific. So we decided to design a study where you had to keep paying attention to the target, but you had to change what you thought was happening in the target. So we took a group of highly hypnotizable people, and in one condition, we had them actually look at the stimuli as we thought they were, colored, black and white. And you see on the right here, lighting up using PET positron emission tomography, showing metabolic activity increasing in parts of the brain that process color. So the inferior temple, the fusiform gyri here. And then in another this activity was greater when they were looking at color than when they were looking at black, white, and gray. In the next part of the experiment, we hypnotized them and said, drain the color from the color pattern that you're seeing, And they would tell us that it looked more like the lower one, that it looked black, white, and gray. In another condition, we asked them to look at a black, white, and gray grid and paint it, fill it full of color. And they said, yes, it looks colorful. And so when they drained the color from the color grid, now looking here at the tall blue bar here, that's what it was like when they were actually looking at color. This is what it was like when they were looking at the same grid, but imagined in hypnosis that it was black and white. And you can see a significant reduction in activity in the color processing region of the brain. Likewise, when they were looking at black, white, and gray and thought they were seeing color, there was a significant increase in blood flow and metabolic activity in the region, in the color processing regions of the brain. So I call this my believing is seeing experiment, that you actually see the combination of the sensory input and your pattern of expectation about what it is. So it's one example in which a kind of interoception can literally alter perception, exteroception.
And it's a nice illustration to pay attention that when you have stimulation come in, that it obviously can be altered internally. None of the external, what they were seeing changed. Right. Their experience of it changed. And we can use that. So interoception in brain is important because it's only recent, in recent times, that people start to pay attention of how the feed from what we called earlier afferent information from the body to the brain actually influences the brain in sometimes, detrimental ways. Many of you probably have noticed either this feeling of like, oh, I can't breathe, or my heart hurts, or something in the chest hurts. And when your chest hurts, it's interoceptive feed. But then if you decide, this is a heart attack and I'm going to the emergency room, or I just need to take a deeper breath, or I squeeze the muscle, is a broad range of interpretations. And these interpretations are important, which a very neat study showed on the following slide. Again, details aren't important, but Carl Deiseroff, I think he'll win a Nobel Prize soon. The design of the study is really neat. But what he showed, he did it in mice, but it's also true in people, as I know from my clinical experience, that when you increase the heart rate of people, or here the mice, the brain perceives it in a way that these mice exerted avoidant behavior. So it was a correspondence of fear, something dangerous happens. Nothing dangerous happened to these mice. Only thing they did is they were able to show that when the heart rate increases, information goes to the brain, and the brain says, oh, this is danger, let me run away. And so that's an illustration of this physical upfeed, where the heart beats faster, and you're not supposed to think this is dangerous. But the brain seems to have a natural tendency, as David mentioned earlier, from earlier times, that when your heart was beating faster, there was probably a good chance that a lion was standing in front of you, and you better run away fast. As humans, we don't have those experiences, but the original mechanism is still there, and that leads to a lot of misinterpretation of these physical signals. And again, I don't know how many in the audience had that experience, but be gentle with it. You can try it again now. If you inhale and hold your breath, and just notice what you experience on the inside. And there's a point where it gets a little uncomfortable. And you hold it after the inhale. And don't force it too much, but observe any thought patterns or feelings you have attached, to, we're doing a purely physical thing. Nothing dangerous happens. You're breathing in, you're holding the breath. And what are you perceiving in response to that? And then you can do the same thing on the exhale when the air is all out. Again, don't take any air in. just hold still. After a few seconds, some people can do that for 10, 20, 30, 50 seconds. But get to that discomfort level and see what happens up here. What are you doing with that stimulation? Are you behaving like the mouse or the rat that says this is danger? An important thing now is that you have influence over your heart, and we'll talk about that in the intervention section, through your breath. You can make your heart go faster or slower. And so when people have a fast heartbeat, they can simply slow it down by slowly exhaling. And we'll do it when we get to that place, but realize that you're not at the mercy like this poor rat where Carl just increased the heart rate and it had to run around in circles when it was scared. You actually can modulate it.
One thing I might add is, the brain analyzes information based on context. And so we know that when people are actually under physical stress, the heart rate goes up, the respiratory rate may go up. And as people have panic attacks, and people every day show up in the emergency room thinking they're having a heart attack, when they feel some discomfort in their chest of the kind Dr. Kogon was talking about, and a rapid increased respiratory rate. And what tends to happen, what we don't realize about breathing, is that the trigger for more breath is not really low oxygen. You do it to replenish your supply of oxygen, but it's high carbon dioxide. You exchange oxygen for carbon dioxide in the body and breathe out the carbon dioxide, but that's the actual trigger to more respiration. When people start having a panic attack, they're breathing faster and faster. They're blowing off more CO2. They're not efficiently taking in oxygen. And then they get scared by that and they do more of it. And it's actually why the sort of trick that people do for people who are having a panic attack in an airplane is they have them blow into a bag, which increases the CO2. The expelled CO2 gets inhaled again and gives them more real inspiratory drive and helps them slow their respiratory rate and breathe more efficiently. So the way our brain is programmed to respond to patterns like these poor mice who were made to feel like they were under threat when in fact they were not, is something that we all live with. And what we need to do is better understand and manage our responses and the kinds of things Dr. Kogon talked about, like not worrying about inhaling so much, but slowly exhaling, triggering the parasympathetic response that tends to slow you down, will also help you breathe more efficiently and counter the anxiety that comes when you're over breathing.
And what I had you do triggered exactly the response David was just talking about. So when you hold your breath, you have sensors that are sensitive to changes in carbon dioxide. So when I had you hold your breath and you didn't breathe off the CO2 and were static, then these receptors say, hey, what's happening? You're not breathing. But again, you have a way into that system, as you'll see in a minute, and we already, have been talking about.
May I just ask for a point of clarification, going back to the slide? You've illuminated the most relevant point to this evening's topic. Just a point of clarification, when the heart rate was increased, what was the mechanism of that, and did it include any intervention to the respiratory system?
No, the cool thing about it was optogenetics. So they were stimulating the perception of stimulating the heart to beat faster, but without any other stress-inducing.
Thank you.
They were controlling. That was what was so cool about this, is Diceros optogenetic model could produce the heart rate change without anything else being changed.
Thank you.
So on the next picture, this is a study that just came out recently, and I put it there because we all talk about, post-COVID responses, and many people, not just with COVID, but post-viral for years have this chronic fatigue, don't feel well, have cognitive changes. And this is an illustration where they could show, humans, and again, don't take that as a proof. I don't want people now to ask their doctors if they have post viral or post COVID changes that this is that they want to change that system. We are hoping that we have a way into that system, but this is a neat explanation of what happens in the inside, and it's fed up through the vagus nerve. David mentioned that system of nerves that feeds this afferent information into the brain. So what they noticed is that people have less serotonin. And in a series, and this was in people, but then they documented in mice in an elegant series of experiments how platelets are affected, signaling systems are affected, but they could show that it's the vagus nerve that feeds up that information to the brain. There's depletion down here. We don't have serotonin down here, and then the brain didn't work as well as in being fatigued or having this cognitive sluggishness. So this is a way where they were showing that it's not necessarily a brain mechanism that makes people fatigue, but it's secondary to something that's missing in the gut. Again, you don't need to know the details. I put it up there to illustrate that what happens in your body has a direct influence on the brain. So it's not just the heart, it's also the gut, it's the lung.
It's worth noting, serotonin is sort of a very popular neurotransmitter because so many people are on selective serotonin reuptake inhibitors, a leading form of antidepressant now. But 90% of the serotonin in the body is manufactured in the gut. And so you can be serotonin deficient, even if your brain is producing a fair amount of it, because that's the source of most of it if something goes wrong in the gut. And with COVID, that seems to be one of the problems that can be related to long COVID.
So in general, on the next picture is just you being aware that what comes up from the body and is fed into the brain can cause all kind of trouble. Some of this is already documented, some of this is discussed, the diseases, disorders, and comorbidities of interoception. So people always think of the brain as this isolated, organ, but it is heavily influenced by what happens between the neck to your legs. The heart, the lung, the gut influences what happens in your brain. And, as we discussed, I think the furthest along we are is with anxiety disorders. We always thought for many years that, there's a big proportion of what happens in anxiety in the brain. But now more and more people start to discuss is the originating factor, what happens to these mice, that there is something happening inside your body, like a fast beating heart, and the brain misinterprets. And then secondarily, you have changes in the brain. So I really want to encourage you, we can take a minute again to just digest that. It's not something people are aware of. People are aware that when they hear something, it stimulates them. Like the joke I made with you earlier. See, you laughing, so you didn't react to it. That, we're used to this external stimulation doing something in the brain, and we deal with it, and we get angry, or we respond, or we're smart about it, or we don't know how to respond. But people aren't aware that when their heart beats faster, that their brain might be in hyperdrive about that. And they're just merrily going along their lives, along their daily lives, and have this system inside of them that's activating them, scaring them, and they're not even aware of it. So again, take a moment right now. Are you comfortable when you take a breath? Does it feel tight? Do you feel like you can open the lung and expand air downward? Does it change how you feel your heart when you do that? The two are very closely correlated. The reason why we ask people to breathe slowly is that there's something that's called resonance breath, where the heartbeat and the frequency of the heart and of the lung breathing are in sync. They like certain 5 to 7 breaths a minute because they get along best when you have that frequency. What are you doing now? Are you breathing faster than roughly 6 breaths a minute? Are you extending the exhale? Are you taking shallow breath? You know, we often ask people to breathe, but particularly people with trauma often don't breathe at all, or breathe very shallow when they do. I shouldn't say don't breathe at all, but when they do breathe,
That's
they
real
don't.
trauma.
Yeah, that wouldn't be good, but they take shallow breath, or they often freeze in breath. And in my work, I often can't use breath in people with trauma because it feels dangerous to them. You know, we talked about the heart beating faster, but to them, freezing is a way of protecting, and freezing means not moving. David talked about dissociation. We're going away from the body or holding still. And that in itself is challenging for the body, that you can't take these breaths because you literally have to freeze the lung and not breathe. So what is happening to you right now? I know we have, you know, many people watching. How are you breathing? Does it feel comfortable? Is your breath flat? Is it deep? Is the exhale as long as the inhale? And what do you experience in your heart when you do that? And are you comfortable changing it? And again, I'll remind you when we get to the next section, when we talk about how to get into that system. But I really want you to keep that picture in mind. What comes, it says, diseases, disorders, and comorbidities of interoception. Take it seriously what happens inside of your body. And you know, if I can help evolution along, I want to make sure that this is not what's going to happen, this overemphasis on the brain, where the brain is a status symbol of its functionality, or unfortunately sometimes dysfunctionality. You know, I purposely put in my introduction my description of what I do for a living, not just mind-body medicine, it's body-mind medicine. It's bidirectional. Don't just use the body the mind to influence the body. Use the body to influence the mind. It's not just mind over body. Sometimes it literally is body over mind. People say, oh, I shouldn't be feeling this way, or I shouldn't be stressed, is something I hear a lot in my work. And guess what? The body is stressed. It has all kind of stuff floating through it. And you just saying I shouldn't be stressed won't do a thing. So there it's body over mind. So don't work on your inflated brains, work on the coordination of your body to your brain. So one way into this bidirectional experience is breathing. And I've encouraged you several times throughout, you know, the session to do that. Again, the details of the picture aren't that important, but I like it because it shows you your entry points into slow breathing. You know, helps your mind. You can use your mind to help with breath. All of that stimulates not just the lung and the heart and balances it, but it influences the vagus nerve, this afferent system. And there I want to point out that 80% of the vagus nerve is an upfeed. So the vagus nerve that comes from the brainstem and goes into the system and tells the heart to beat at whatever rate, or tells the lung to breathe whenever. Only 20% of those fibers go down, 80% go up. That means there's a lot of information constantly, right now, as we're speaking, traveling from the inside up. Right now, heart, lung, belly, Are you hungry? Are you paying attention to being hungry? So breathing as a way, probably, you will probably say hypnosis is an easier way in than breath. You know, for me, there's something mechanical about breath that doesn't require mind. You know, hypnosis is both. It requires mind and body. And, you know, my mind tends to go off in like 50 million directions, not always, you know, to the betterment of my life or other people's lives. You can attest to that, right?
Yeah, I can.
So I like breath because of its simplicity. You know, I feel like, okay, slow breath. And I would like to do that with you right now. You know, where you see these clinical outcomes, it has so many things that influence, that get influenced, like your blood pressure, your heart rate, you know, all kind of stuff, all these studies they mentioned. And so this is, David mentioned this. So as we're breathing, we're changing our you know, our carbon dioxide content, and that in itself then influences the brain. And this is this nice entry point into, since the brain regulates respiration, so the brain says, you know, breathe faster, slower, and then through that respiration it changes the CO2, as we mentioned. The brain can so exercise control over its own excitability. You know, we both gave illustrations of breathing or the heart, that if you don't, you know, feel it in a balanced way, the brain gets excited. You know, in the Dice-Roth study, the mice or the rats were running around in fear just because their heart beat faster. So the brain got excited just because the heart beat faster. So you can now, right now, take control over making that heart beat more slowly, and the brain will be less excited.
You know, one of the fascinating things about respiration in particular is that it's the one sort of physiological function that you can very quickly control. We do all the time. We decide to, just as we were doing as Dr. Kogon was talking. But if you don't, it will take care of itself. It'll function. So it's right at the nub of automatic versus brain consciously controlled physiological function. And so it's a way of getting right at the crux of our ability to control it. And it's interesting that many of our social rituals, like, for example, singing, involve doing what Dr. Kogon was showing you before in cyclic sighing. You do a quick inhale and a slow exhale as you sing. And it's a social institution that helps us regulate our degree of arousal. And there are many others.
Yeah, and you can give, I think that's actually on the next picture. Is it? Yeah. So here, that is the study we did where we compared different types of breath. And overall, you know, we can talk a little bit about the differences, but the important thing I want you to take from it, that breath work in general improves mood, reduction in negative emotion. I put that negative in quotation marks because I believe in what the Buddhists teach us, to not label emotion as good or bad. It's just all emotions. It's a production of the mind and the body. If you're sad, you know, it takes the body and the mind to have that experience. When you're angry, it takes almost more body than mind. You know, your juices flow, your heartbeat, you know, anger is a very physical experience. But try to not label it. You know, I've encouraged you to notice what happens to the body and the mind, but now more and more to the body when you have these feelings. So it's an emotion. Anger is an emotion. Sadness is an emotion. Fear is an emotion. But these emotions have strong physical components.
And one of the fascinating things about this in particular, all of we just asked people to do each of one of these four things. They were randomized 5 minutes a day for a month. And what we found was that all three of the breathing exercises improved mood, made people on average feel better, not just after they did it. But the particularly interesting thing was cyclic sighing that we've been explaining actually had the effect of lowering the average respiratory rate. And in general, we overbreathe. We breathe too much. We breathe like 10 to 12 times a minute. As Dr. Kogon said, 6 is ideal. So you want to breathe more slowly and deeply, and that will calm your brain. It's less likely to be aroused. So it's a calming exercise and experience. And it's something simple and direct that we can do very quickly to alter our state of arousal. And our brains know it, but we don't always listen to our brains.
And we're now in the process of trying to figure out what exactly is the effect. So we're trying to repeat the study, then actually put people in a scanner to see what is happening up here and what are the mediating factors. But let's do this sigh again, because I want you to, you can either do it, thanks for mentioning the 5 minutes. That was really the thing that totally surprised me, that with 5 minutes a day, that's very little. Most activities you do a day take more than 5 minutes, but you take 5 minutes and have this pronounced effect. That the small dose approach is what has convinced me to consistently cyclic sigh. I used to try to regulate my breath. I was playing around with box breathing. I'll show you in a minute. And I think you mentioned it also demonstrated it in a different talk. But I want you to feel it, that this physiological sigh seems to, function physiologically differently than other types of breath. And we're in the process of trying to figure out what that effect is and how that happens, how come it is different. So let's do it again. You can put your hand on your chest or belly. Some people, when they expand the lung, I told you to not pull up your shoulders, but kind of just inhale, almost imagine just blowing up a balloon outward, downward. And some people can feel that in your belly or your chest. So that's how you can monitor that it's actually happening. And again, for the people who are worried about or can't really take these deep breaths, just be gentle with it and just put your hands on your chest and belly. But the ones who can take these breaths, breathe in. And then there's the spot without straining where you feel like, oh, the lung is full. But if you just add a little bit, just an extra little whiff, you notice that there's more room there. So you casually do that. You actually don't kind of pause between this double inhale. So I'm just doing this now to demonstrate that there is more room. So you breathe, add a little, and then immediately, don't hold it, immediately exhale. And sometimes air just comes out quickly. So you can put your lips together gently so you can slow that exhale. And make sure that exhale 6, 8, 10 seconds. Again, depending on your carbon dioxide tolerance, it'll be different for different people, but that you find this soft spot. Inhale, extended exhale, and you can, I like your singing remark, if you at the sigh and don't feel too ridiculous doing it, you can do it quietly, but that exhale sound actually helps with the extension of the and then just do that. I'll be quiet for a minute and just do that 2 times, 3 times, and see what happens. Notice your thinking. Is there still associated thinking? Do your emotions shift? Don't be surprised. Sometimes people feel a whiff of sadness when they relax. You can just let that flow. It's not necessarily, happiness in that calming down. Sometimes there is an emotional release in that relaxation. And I now want to show you a breath that has a very high potential of crowding out your thinking. You know, interoception is a nice way of crowding out thinking. For example, we haven't talked about proprioception. It's this area, this interplay of exteroception and interoception. So proprioception is your perception of space in space. So for example, if you stand on one leg, you're not really balanced, and your cerebellum, the part of the brain that controls that, together with the inner ear, is working pretty hard. So if you combine a cyclic sigh with exteroception, proprioception, and interoception, I'll show you in a minute how to do that, it crowds out your thinking. So for the people among you who are crowded by thoughts, you know, this intrusive stuff, repetitive rumination, you know, you don't want to think about it and it just thinks itself, this might work. So how that works is that you just put your hand belly on or chest, and that's tactile. So that's an exteroceptive stimulus. You feel your hand on your chest. You're not breathing, but just the touch, that's exteroception. Expanding the lung comes from the inside. That's interoception. But if you notice the movement of the hand when you're breathing in, you're not paying attention to the touch on your chest. You're not paying attention to the expansion of the lung, but you're paying attention to the movement of the hand. That's proprioception. And if you now cycle through, you take a cyclic sigh and just feel the tactile exteroception on your chest. On the next cyclic sigh, you feel the lung expand, interoception. And on the third, you just pay attention to the hand on the chest or the belly. And not the expansion of the lung, but the movement of the hand through the expansion of the lung. That's proprioception. Because it moves and it has to perceive. The hand itself, if you move your hands like that, they perceive and signal to the brain, how are we in space? And so that the complexity of that breath should help the people, the overthinkers among you. You can also do that at night, scale back your overthinking. So next entry point, David's expertise, hypnosis.
So one of the things that happens, we took people who were highly hypnotizable, compared those who weren't. And when they went into a hypnotic state in the MRI scanner, we saw a marked reduction in activity, in functional activity and blood flow in the dorsal anterior cingulate cortex right here, the yellow circle there. And you see here a correlation between how hypnotized people felt and how much they reduced activity in this part of the salience network. So one of the things that helps you concentrate so intently in hypnosis is the ability to turn down activity in the salience network, to not let your brain distract you from the focus of your attention. So the ability to intensify your focus, to get into a flow-like state, to, you know, being in hypnosis is like looking through the telephoto lens in a camera. What you see with great detail. You're less aware of what's going on around. That is dissociated. So that's a major factor of what happens. And it's why there have been studies now that show that people who are highly hypnotizable are the kind of people who get so caught up in a sunset that they kind of let time pass and don't realize it, or who will work for 3 hours and realize that they've missed dinner. And I shouldn't have said that while you're missing dinner, but it's this capacity to intensify your focus of attention. And there, the kind of interoception that you experience in hypnosis, or what's going on in your body, can alter the way your brain reacts to stimuli in the study that Dr. Kogon already mentioned. That interoception modulates exteroception. You're imagining something internally that's blocking your view of something you're actually looking at, and you reduce your brain's response to those stimuli. Now, this has particular salience for things like pain, and I'll show you some data about that, but I thought you might want to try a brief hypnotic exercise to see what it feels like to privilege what's going on inside and to minimize and alter your experience of what's going on outside, your exteroception. So if you want to just watch, that's fine, but get as comfortable as you can. And I'll ask you on one, do one thing, look up to the top of your head. 2, do 2 things, slowly close your eyes and take a deep breath. And 3, do 3 things, let the breath out slowly, let your eyes relax, but keep them closed, and let your body float. And then take one hand or another, left or right, and let it float up in the air like a balloon, higher and higher as the rest of your body feels heavy and relaxed, so that with your elbow resting next to your side, your hand is floating up in the air. And notice how quickly and easily you can let one hand feel lighter than the other, to the point that even if you pull that hand down with the other hand, it will float right back up to the upright position. You'll find something pleasant and amusing about that sensation. And this is a way of showing yourself how quickly and easily you can alter the way your mind and your body interact. Now just imagine you're floating somewhere safe and comfortable, a bath, a lake, a hot tub, or floating in space. Notice how you can use your store of memories and your imagination to help yourself and your body feel better. If you happen to have any part of your body that has discomfort, if you're experiencing some pain, imagine that the water you're floating in is cool, tingling, chilling, if that's what gives you relief, or warm. And let the cool, tingling numbness or the warmth filter the hurt out of the pain, so that you focus on this altering of sensation interoceptively, and notice the effect it has on any discomfort, signals of discomfort that you have. You can also just detach yourself from where you are. Picture yourself being somewhere else. Picture on an imaginary screen, being in a mountain lake or being at the beach. And notice how even if what you're picturing is something that worries or troubles you, you can do it with your body feeling safe and comfortable, so that you dissociate any psychological tension or stress you have from the physical one. You start from your body up, you make your body comfortable, you soothe your body, and then you deal with whatever it is that may be stressful to you. Now take a moment to enjoy this experience of your ability to change the way your body feels, make it more comfortable. And now we'll come out of the state of self-hypnosis by counting backwards from 3 to 1. Let your hand float back down, make a fist open. Feel the way it did at the beginning. Take a deep breath, breath out. Let your eyes relax, but keep them closed. And then let your eyes open. 3, 2, 1. Now, please notice how peaceful and comfortable your body can feel and you can feel. And one of the things that Dr. Kogon and I are both asking you to consider is that traditional psychotherapy has focused on understanding why you're anxious or tense if you are, and then trying to reduce that and make your body feel better, which is a good thing to do. But doing it body up is also a very effective and often rapid way of helping yourself and your body feel more comfortable. So just as Dr. Diceroth showed that if you make a mouse's body to seem anxious, it will get anxious. If you make your body feel comfortable, you can reduce your anxiety that way. You can turn anxiety into fear, figure out what's troubling you, and see what you can do to fix it, but do it from the body up rather than from the head down. So I'll just very quickly point out, and then we want to leave time for questions and comments, is that it is possible to literally change pain perception with hypnosis. So one powerful therapeutic way of managing pain is not to take opioids, which are killing 70,000 Americans last year, but instead, words given in hypnosis to people actually reduce their pain, either in the somatosensory cortex on the left, if you say, like I said to you a few minutes ago, cool, tingling numbness, or if you say, well, the pain's there, but it won't bother you so much. You get analgesia, but in the dorsal anterior cingulate cortex, you reduce activity there. So the brain can literally change activity in salient regions of the brain, and that can result in a reduction in pain, just like the visual study that we mentioned earlier. And we've been able to show in randomized clinical trials, this was published in The Lancet, that if you take 3 groups of patients getting arterial procedures, arterial cut downs, allow them all to push a button and get opioids if they need them, that the group that was randomized to self-hypnosis after 2.5 hours of this procedure, which is not a lot of fun, their pain level was only 1 out of 10. The standard care group, their pain level was 4 times higher, 4 out of 10, and they were using twice as much opioids. So, and the anxiety levels were just plain 0 in the hypnosis group. I thought they maybe died or something. They were fine. They were 4.5 out of 10 in the standard care group, again, on twice as much opioids. There were more complications because of the increased opioid use, and it took 17 minutes less time to do the procedures. And one of the things that troubles and saddens me is that if we had published this result in The Lancet in a large clinical trial, and what we were doing was giving them another drug, everybody'd be using it. But because people have trouble accepting the idea that this kind of brain ability for the brain to control the body and recognize that the body controls the brain as well, we can intervene in these pathways in a way that helps people feel more comfortable very quickly and much more safely. And this works as well for people with chronic disease. These were women with metastatic breast cancer. We taught them in weekly support groups to do self-hypnosis for pain control. And by the end of the year, the women randomized to this kind of program had half the pain that the control group did on the same and very low amounts of medication. Now, many people are impressed by this. Our daughter, when she was much younger, did a little drawing of what her daddy does. She says, my dad hypnotizes people and makes them want to live longer, and you see a particularly successful clinical example here. She's now an attorney, and she wants me to tell you that this does not represent her current level of artistic ability. But I hope it does illustrate that the brain and the body have a lot to do with one another, and we can help brain and body by working from both ends, by teaching the brain how to function better, but also by using the body as a signal system for the brain and helping us to manage stress and other discomforts physiologically from the body to the brain, as well as from the brain to the body. So we thank you for your attention. We hope you're feeling more comfortable now, and we'd be glad to have a discussion.
Thank you both for your illuminating presentation. We have a question about, is self-hypnosis a solid option instead of hypnosis mediated through a guide?
Yes, it is. We have actually, because I wanted to spread the wealth and because I know that all hypnosis is really self-hypnosis, disclosure, I'm a co-founder of Reverie, R-E-V-E-R-I. It's a digital interactive hypnosis app that people can use to control pain, stress, insomnia, deal with habits. You get to hear my mellifluous voice anytime you want. the app has had about 500,000 downloads, and I am excited to think that we can now help anybody anywhere with a smartphone learn to use self-hypnosis on their own. And we've had people reporting that their reduction in stress and pain, about 4 out of 5 of them get an immediate reduction in stress, pain, and other problems. So yes, it is entirely possible to do it. You can download it from the App Store if you have an iOS phone, or Google Play if you have an Android.
Thank you for guiding us to that resource. Another question regarding the terminology dissociation or dissociated, and also the reference to the freeze state. What is your experience with individuals stating that they are associating to another place other than their body or their mind, to a realm of being held by an eternal quality of love and presence that's not nameable, not palpable, or some people would call it a cosmic presence or a divine presence? And could you speak to any inquiry you've done into that other perspective on the dissociated state?
Yeah, I very much appreciate that question, because dissociation, unfortunately, isn't just looked at this mechanism of separateness. It has this pathology attached to it, from the categorization of illnesses. But I want people to just look at consciousness on a continuum. Just imagine, I think you mentioned earlier, you can be absorbed even if you drive down the street and not paying attention to, listening to music. All of a sudden you notice that you pass the exit. That is a different state of consciousness. And so depending on how we change that state, I often don't even use the word altered. I just say different state of consciousness. People can have profound experiences. I mean, there's certain types of breath that we didn't mention because I'm sometimes, careful to mention them, because I don't want people to just do it. But increased frequency breath, like holotropic breathing, changes your state of consciousness, and people have profound experiences. People call it psychedelics, or do it together with mind-altering substances. So again, think, and people then might have experiences that to them feel out of world, have a dimension that goes beyond them. I mean, we have had conversations about consciousness. Is that just a production of mind, or is it something beyond mind? And we can have a conversation about spirituality or religion, but just have an open mind of a continuum of these states. And
one thing I'd add to that is that even on the sort of low end of that, not these extreme alterations in consciousness, but just the capacity to let go of your usual presuppositions about who you are and what you must be, is a wonderful context for change. Because rather than deciding to be different and working at it for a long time, you can try it out and see what it feels like. You can do that with psychedelics. You can do it in a much milder way in hypnosis, and with some of this breath work. You can just try out being different and see what it feels like. And that's a very powerful, useful way of changing.
And I just want to modify that. Do it with psychedelics. Be thoughtful. Yes, you can do that, but we have a reemergence of psychedelics that is wonderful, but also a flooding lately of market forces that aren't only facilitating health. So absolutely, a wonderful way to do it, but be thoughtful when you do that.
And given that this topic of the increase prevalence and focus on psychedelics is an era we're entering into, has come up in the summit previously, I'll share some of the responses that other speakers have provided and invite you to comment on their commentary. Specifically, individuals spoke about the sort of momentary alteration in consciousness that can come from a psychedelic mediated experience. but that the intention within the arc of a contemplative tradition is to reach the capacity to self-modulate one's states of consciousness through breath and other mediums of practice in order to be able to contribute to the greater good for all people and the planet, and not just for one's own personal reduction of distress and anxiety, but to facilitate the ability to think on your feet and make a difference that might help yourself and help the collective. So if you could speak to how, from your depth of professional experience and expertise, how the current focus on psychedelics misses that other dimension.
Yeah, I mean, I've thought about that a lot because I'm a consciousness junkie and spend a big proportion of my day reflecting on these things. So your comment about it's a one-time moment that's more about oneself is true. However, since the thinking changes, we mentioned default network activity is often reduced, and so this self-critical, self-judgmental way we often think about ourselves is suspended, so people can think about themselves in a more positive, in a more loving, in a more self-accepting way, and that does carry over. You have these experiences where you then realize, oh, I had an experience where I did have a positive experience with myself. So people who take that process seriously then tend to change in ways that they can also pay better attention to other people, are more open in their communication, are more playful, are more accepting. So I hear the comment and I agree with it, but I want to modify it because some people take a psychedelic experience very, very seriously and very thoughtful and very gentle and very mind and peace expanding.
Lord knows we need people to change and be more concerned about others than themselves. And a lot of these techniques, meditation, hypnosis to some extent, psychedelics, are partly about getting over yourself, about letting go of it and not letting your perspective of yourself and how important you are determine what reality is. And I see that in dying patients taking psilocybin, dying cancer patients who are able to look at non-being, look at their death, and yet be grateful for the life that they've had. And the fascinating thing is that it's just one or two experiences changes them permanently. And so I think there's a new paper coming out in Nature Medicine from Dr. Nolan Williams' lab showing that people with traumatic brain injuries in military combat taking ayahuasca are substantially improved. And so I just think, when we think about dangerous things, they're often drugs that have dangerous side effects, or they're situations where people lose the capacity to let go of themselves and see things from a different perspective. And there's something about changing perspective that is inherently good, not just for people, but for the people around those people.
And not have a quick fix mentality about it. That's right. What I struggle with. If you look to psychedelics as a quick fix, it's not a quick fix. But if you do them thoughtfully, it results in mind expansion and self-experience. David just said, that is a contribution to the world in a good way.
And our final question about this is, what do you feel is the path to making enough public awareness about the power of the breath practices and the interoceptive information that you shared with us available? I'm not aware of any public health initiative or statement from the Surgeon General or the World Health Organization that is featuring the low risk, high benefit dimensions of breath work and interoceptive understanding.
Well, we've made a little headway.
We have. There's one bit of good news. Mayor Eric Adams of New York, where I grew up, in a city not known for its low levels of stress, has decreed that all students in the New York City public schools will start the day with breath work. And so the idea that big systems like that, and he said there's evidence, he cites our study and others, that it helps. So I think it's beginning to seep into more general consciousness that there are simple, straightforward things we can do that help us feel better, manage stress better, and free ourselves to care more about others. So we got a long way to go, but the train is moving.
Yeah, and it's also grassroots. I mean, whoever was drawn to this talk today, spread the word, inspire other people, breathe your way into peaceful conversations with your partner. I mean, I have a rule that I don't, when I'm, activated or stressed, that I don't interact, that I don't make important choices until I have a balanced system. And I always regret when I don't follow that rule.
That's why we've been able to work together for 30
exactly
years,
29 and a half, and he's going to throw me a party April 1st next year.
April
30 years.
Right.
Exactly. It was a fool's day when I started with him.
Right. Well, if you can hang on for another 6 months.
All right. I'll do my best.
Well, thank you for the breathing of laughter. Thank you so much for sharing your wisdom and expertise with us.
You're most welcome. Thank
Bye.
you for being here with us. Hello.